Joining us at the Asian Financial Forum 2015 is Abu Bakar Suleiman. He is the chairman of IHH Health Bhd in Malaysia, and thanks very much indeed for joining us today. I'd like to really start, because of your background in health in Malaysia, looking at what that is in terms of referencing the economic development of Malaysia. To what extent has that been the case, would you say, over the last several years?
Well, developing a healthy nation, which means healthy individuals and families, must be one of the objectives of any government. And this must be owned by the people. And if we look at Malaysia's development, as we grow economically, the health status of the people have also improved tremendously. And this helps the country to be more productive.
To what extent would you say that healthcare has been critical, if you like, where it comes to the development of Asian economies, actually?
Well, I think if we look at the developed countries and we look where the emerging economies are, there's a big gap between the expectation and the needs of the people and what can be delivered. And I think the health component is a critical part where the gap is very big. And I think the spending in this area is going to increase tremendously over the next 10, 20 years. Particularly with the aging of the population, with the increase of chronic diseases. I mean, the wealth of any nation actually depends on how healthy the people are. And individually, what is wealth without health?
And where it comes to certainly health and the development of health and the spending on health, one would think that China is really very critical in the Asia-Pacific region where it comes to this, because of its aging population and because of requirements for health.
Yes, I think China is amazing because they have a big aging population, for one, but the healthcare spending growth is growing at 16%, whereas in the developed countries it may be about 5%. Of course, China is going from a low base, but still it is very high. So we can see that there's a lot of demand there, and there's a lot of infrastructure that needs to be built up in terms of healthcare.
Now, to what extent would you say Hong Kong was a significant kind of center because of its position as a financial center in this part of the world? Is this important where it comes to distribution of both technology, of course, and the products themselves where it comes to healthcare?
Well, Hong Kong is an amazing place because they got excellent public services to the extent that private sector loses patients to the public sector. That's how good the public services are. And they got excellent health status. They're also very innovative. They got their own health record, electronic health record, which they built themselves. So this means they got a lot of capacity for innovation.
Now, the theme for the Asian Financial Forum 2015 is regional sustainability in a world of change. Now, to what extent would you say sustainability is really reliant, in fact, on medical services and medical supplies?
Sustainability depends on a lot of things, but the critical matter will be the human capital. And what do you call it? There's a lot that needs to be done in terms of development of human capital. And the health component, obviously, is a very important part of that.